Welcome to Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Now, we recently did an episode talking about hospice, and during that episode, we mentioned palliative care and how the two are similar, yet different. So today we're going to be discussing palliative care and what it is and how it's different than hospice. But first, we wanted to give the definition of palliative care as defined by the Merriam-Webster Dictionary. Palliative care is defined as medical and related care provided to a patient with a serious, life-threatening, or terminal illness that is not intended to provide curative treatment, but rather to manage symptoms, relieve pain and discomfort, improve quality of life, and meet social and spiritual needs of the patient. Now, if you didn't know that we were providing the definition for palliative care, and we asked you, what did we just define? There's a very good chance that many of you would have said hospice. Their definitions are very similar, and so we found a good quote that we wanted to share with you from Jane Brody that was featured in the New York Times from December 3rd, 2013. And in her quote, Jane had said, "Many still believe palliative care is appropriate only when nothing more can be done to treat a patient's disease and prolong life. But, unlike hospice, palliative care can and should be delivered while patients continue treatment for their diseases." This quote does a really good job of making the distinction between hospice care and palliative care. Palliative care can and should be delivered while patients continue treatment for their diseases. And this distinction is what really separates the care between the two. However, there are some other differences that differentiate hospice from palliative care. First are the eligibility requirements. Hospice eligibility requires that 2 doctors must certify that the patient has less than 6 months to live if their illness or disease follows its traditional course. However, with palliative care, it can be started at the discretion of just one doctor and the patient during any time of their illness, whether it's considered terminal or not. Next, the way that palliative care is paid for varies by the patient's provider and insurance coverage. Families and their loved ones will want to check with their insurance carrier or their health care plan to get details on what is covered and what's not covered, and whether you are responsible for copays or any out-of-pocket expenses or other charges. Medicare Part B and Medicaid will cover some types of palliative care, but you may have copays for some treatments and medications are not covered. The same holds true for private plans, which typically cover palliative care, but plans and coverages can differ for each insurer, so it's always recommended to contact your specific insurer to inquire on their coverage for palliative care services. So what is palliative care? Palliative care is a healthcare specialty that focuses on managing pain, symptoms, and stress of a serious illness for patients of any age and at any stage of a disease or illness. There are several services and care solutions offered by palliative care, such as symptom management, pain management, help and support navigating treatment options, advanced care planning, and comfort measures that will support the patient's quality of life, and offer referrals to community resources. And as with hospice, palliative care can be provided at home or in other settings such as a nursing home, a rehab facility, or in a hospital. The palliative care team may include the patient, caregivers, a doctor, a nurse, a pharmacist, a dietitian, physical and occupational therapists, as well as social workers and chaplains if the family or the patient wishes, as well as other healthcare professionals. It's important to note that palliative care can be used in conjunction and alongside other primary treatments. Sometimes families or their loved ones or both are not ready to stop their treatments or other curative measures, and palliative care allows for them to continue their treatments and benefit from the support of the palliative care team. And it's also an option for them if they're not emotionally prepared for end-of-life care, which then would be considered hospice care. Another good benefit, though, for families and their loved ones considering whether or not palliative care would be a good choice for them as a care option is called the Downstream Effect. The comfort, support, and benefit that a patient receives from palliative care is tremendous, but the family also receives benefit from it as well. When a family's loved one is more comfortable, has reduced pain, and reduced anxiety, it's been shown to also have a positive effect on the family caregivers as well. And studies have shown that family caregivers of a serious ill patient who receives palliative care show an improvement in their stamina, their social functioning, and they experience less symptoms of depression as well. If you're interested in reading about this particular study, you can find it on ehospice.com. And the study was titled Early Palliative Care Provides Important Benefits for Family Caregivers of Patients with Cancer. And remember, you can start with palliative care and move to hospice, or if you decide that hospice is the right choice for your situation, you can choose to move back to palliative care as well if you decide to. Whatever the reason or path that is right for you, you'll always have a choice, and your healthcare team will honor your choices. These are decisions that are very personal, and your decision will always be respected. We hope that this episode here at All Home Care Matters was helpful, informative, and something that mattered to you. And we want to thank you for joining us here at All Home Care Matters today. All Home Care Matters is here for you and to help families as they navigate long-term care issues. We invite you to please visit us at allhomecarematters.com, where there is a private, secure, fillable form where you can give us feedback, or maybe you have show ideas or questions. Every form is read and responded to. And if you know someone who could benefit from this episode and information, please share it with them. And we hope to see you next time here at All Home Care Matters, where we're going to be discussing a little nemesis that can cause havoc in the elderly, and those are UTIs, urinary tract infections. You won't want to miss it. Thank you so much for being here.
Thank you for joining us today. We look forward to you joining us again on another episode of Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.